What you are about to see in the next 30 minutes is a documentary, hopefully to make you aware of the mental health problems in this country. After seeing this documentary, which runs no more than 30 minutes, if you would like to send a donation or get involved, because you certainly can be a volunteer or someone who supports mental illness. Mental Health Community Centers, 240 South Tuttle, Sarasota, Florida, 34237, and attention Peter Howard, Executive Director. Thank you so much.
Well, the federal government spends $125 billion on mental health annually. Yet Congressman Buchanan and Murphy say there are still millions of Americans who go untreated.
What more can we be doing in terms of mental health? Because a lot of people with mental illness are in our jails or in our emergency rooms, and that's got to change.
Congressman Buchanan hosted Congressman Tim Murphy, a Pennsylvania psychologist, at a town hall meeting to discuss his bill, the Helping Families in Mental Health Crisis Act.
We're seeking real reforms. Where the federal government has programs that are ineffective, stop them. Where they're effective, increase them. Where they're redundant, merge them.
Murphy says 40% of the time people who have a mental illness are not aware. During the town hall, several family members echoed their concerns over the level of involvement they're allowed to have in their family members' treatment.
Will they even give you information on who his treating doctor is, what his medication is, when his next appointment is?
They won't even tell me who's there. Like he said, I want her out. He told the nurse, I want my mother out. They left me in a hallway for hours. I had no idea what they were doing with him.
Murphy says the bill aims to change HIPAA law to allow healthcare professionals to share some basic information with families.
That you would be able to share just enough information. When's the next appointment? What's the treatment plan? What's the diagnosis? What's the medication? In order to facilitate that person getting better.
Buchanan says there hasn't been any major reform regarding mental health care since JFK's presidency. And Murphy says he hopes the attention paid to the recent apparent suicide of Robin Williams will focus attention to the cause.
We now had 40,000 suicides in this country last year and 1 million suicide attempts. And all those families, they're also deeply touched by this. They recognize the need for this. And quite frankly, I hope if there's a positive that can come out of what happened to Robin Williams is those families will contact their member of Congress and say, please do something. Don't just let this slide by again.
Now, the bill also addresses the need for more physicians and facilities to treat those with mental illness.
What is your mental health diagnosis?
Schizophrenia.
How old were you when you developed this condition?
I was 20 years old.
20 years old. And what is it like living with schizophrenia at that age?
It's very challenging. I was a young man who had many dreams, and a lot of doors were closed at the time, such as I wanted to be in the military, and I was unable to go because of my mental illness. And it just limited my options of my goals in life.
Well, how do you cope with these symptoms every day? I mean, it's difficult.
Yes. On a daily basis, it can be very challenging. I've been very fortunate to be an employee of the Mental Health Community Centers for over 20 years. And the staff, over the years, along with the volunteers to run the support groups, have been amazingly supportive, very compassionate. The staff at Mental Health Center has been very compassionate people, and they care, and they're educated about mental illness. And without them, I'm not sure where I'd be.
Well, thank the good Lord that you do have a support system like this.
Yes.
And Your mother has been a guiding light, I'm sure. In all these years, she has taken care of you too. Is she still alive?
Yes, my mom is alive and well. She lives in Sarasota. Actually, my mom has been involved in the Mental Health Community Center over the years, occasionally volunteering and donating food and items to the mental health centers. So she's happily married to a really good man. And we still have a great relationship. We go to baseball games together, dinner, and holidays we celebrate, and she was my voice for me when I couldn't speak for myself. And she visited me every institution I had been in at the onset of my disease, and was there for me, spoke to my doctors, and she's the reason why I'm on Clozaril today, because she found out about it.
So, you would definitely say that on the right meds, you can lead a normal life?
It is, it is one of the main reasons I'm sitting here today, is because I've been medicine compliant. I've taken my meds every night as prescribed, and I haven't been institutionalized since, and that's been over 20 years. There are some negatives that I have to deal with, such as weight gain is very easy, along with being sedated. But I always looked at the pros and the cons of taking the medication, and I would rather cope with the side effects and continue to live very close to a normal life.
Tell me first about your background.
Well, Barbara, I grew up in the Philadelphia area and did my college, medical school, as well as residency training in psychiatry in Philadelphia. After that, I was in the Air Force, where I served as an Air Force psychiatrist at Keesler Air Force Base. And then my wife and I moved to the Boston area, where we raised our family, and where I was in private practice for over 30 years. Then we relocated to beautiful Venice, Florida, and have been living here, and I've been employed as a staff psychiatrist at Coastal Behavioral Health Care here in Sarasota.
What is Coastal Behavioral?
Coastal is a not-for-profit mental health clinic. We treat adults and children with many chronic mental health conditions with various modalities, including individual and family psychotherapy, hospitalization, outpatient treatment, as well as something called the FACT team, which is a more intensive form of outpatient treatment in which therapists actually enter patients' homes. We have social workers, therapists, case managers, nurse practitioners, as well as psychiatrists to help our patients deal with their problems.
Oh, and that is primarily what you do there at Coastal Behavioral?
My role as a psychiatrist, as an outpatient psychiatrist, is to treat the medical end of their problems. I do psychopharmacology or medication management, but I do this in conjunction with the help of our therapists and nurses and case managers to help them to cope with the conditions that they're trying to live with.
What are common conditions you treat?
We treat many kinds of conditions. We treat chronic depression, many types of anxiety disorders, obsessive compulsive disorders, ADD and ADHD, schizophrenia, and bipolar disorder. We treat with various kinds of modalities, including individual therapy, family counseling, hospitalization if necessary, and the use of various kinds of medications to help the patients get through life suffering less symptomatically.
What is schizophrenia?
Schizophrenia is a chronic mental illness which often begins in the late teens or early 20s, and is characterized by the onset of psychotic symptoms such as hallucinations and delusions. Hallucinations may be in the form of voices or visions, and delusions may be in the form of frightening ideas of persecution or other kinds of ideas that dominate the patient's lives and make it very difficult for them to function. In addition, over time, there are other kinds of problems associated with brain function that occur with schizophrenics. They have a great deal of difficulty initiating actions, planning things, executing plans even if they are able to think of them. Over time, they may develop serious memory difficulties, which can interfere with their functioning. We try to focus on giving support to the patients and their families and encourage them to accept treatment with medications that may help to at least modify, if not totally eradicate, the symptoms. The typical types of medications we use are antipsychotic, and they control some of the more severe symptoms of schizophrenia. The most effective medication is one called clozapine, which often helps improve function greatly, but it has many side effects and has to be monitored carefully. We often treat chronic schizophrenic patients with injectable medications because they can be given less frequently, such as every few weeks or every month, which makes it easier for the patients to comply. Sometimes, over time, in working with the patients' families and with the patients, one can really help to enhance their quality of life to the extent where sometimes they're able to work or have social relationships, and so it makes a difference even if they are disabled to the extent that they're unable to completely care for themselves or be self-supporting.
Oh. Now, what is bipolar?
Bipolar disorder is another type of chronic mental illness that also often begins in late teens, sometimes even earlier. A bipolar patient may go through periods of time when they're profoundly depressed, unable to function, sometimes may be suicidal, and require hospitalization for this. And then they may have other periods in their lives where their mood swings into an opposite direction. They may become euphoric. They may need little, if any, sleep. They may do things on impulse that may be very destructive, such as spending large amounts of money or do other kinds of inappropriate things like stealing or getting into all kinds of difficulties. And may not be aware of the difficulties that they're getting into by their behaviors. The goal of treating a bipolar patient is to help to get these mood swings under control so that they can lead a more normal life and not have it dominated by these mood changes. We typically use medications called mood stabilizers to help these patients. One of the oldest ones is something called lithium carbonate. It's been around for over 50 years now, and it's still considered very effective, although it has many side effects that have to be monitored. Other kinds of mood stabilizers are the anti-epileptic drugs such as valproic acid, which is Depakote, or Tegretol, which is carbamazepine. These can be very useful. We also use some of the same antipsychotic drugs in treating bipolar disorder as we use to treat schizophrenia, although often the dosages are different.
What are the most difficult problems you have with some of your patients?
There are many problems apart from their mental health issues. Many of them have serious financial problems, and sometimes this may interfere with their ability to afford their medications. Therefore, they may not take them with regularity, and they can become ill. Along with that go sometimes housing problems and other kinds of social problems related to that. In addition, our patients often have chronic medical problems which are not adequately treated. And having a combination of a serious medical illness with psychiatric illness makes it doubly difficult. Some of our patients have drug and alcohol problems, so-called dual diagnosis, so that in addition to trying to help them deal with their chronic mental illness, we have to help them to get control over their addictions. They may have legal problems and may wind up doing stints in jail where they miss treatment. Unfortunately, they sometimes have very poor family support, difficulties in their marital situation or with their children, and these kinds of stresses make it harder for them to contend with their mental illness. So these folks have to deal with a host of difficulties which we as their treaters have to be aware of and take into consideration when we're trying to help them.
Well, now tell me, what would make your job easier?
I've thought about that question a lot. One thing that has been very useful is the ability to treat the medical conditions that the patients have and the mental health conditions in the same location at the same time. There have been stretches where I've been able to work with the primary care physician right there on site. And having this kind of communication is really to the advantage of the patient that we're both treating. And sometimes that isn't possible, and sometimes we have less than optimal communication with the other treaters that the patients have. So having better communication, and even ideally having the doctor actually on site would really be a plus in the work that I do. The second issue has to do with an insurance difficulty. If you work hard over a period of time and are able to establish a treatment plan that works, there's no guarantee that the patient's insurances will continue to cover it. So that I've had experiences where patients are rather arbitrarily refused coverage for medication that they have been treated with for months or sometimes years, and suddenly either their insurance is changed, or even worse, the insurance that they have decides that they're no longer going to cover a given medication, so that a patient whom we work very hard to get well, suddenly you have to start from scratch and try another medication which may not work as well.
Oh my. Well, thank you so much. You have been most informative and has certainly taught me a lot about mental illness. And I certainly hope everyone out there will understand and become more aware of how important it is to tell the world, the country, the millions of people that are in this world, how important it is to be on top of this and make sure that you are aware of what's going on. Because of all that has happened in Columbine, Sandy Hook, all due if they would have had help, if they had the right doctors and the right medications, this could be a much happier and wonderful place to live in. Thank you, Doctor.
It's been my pleasure, Barbara.
Thank you so much.
You're welcome.
Good afternoon. Today we're here with Cheryl Mitchell, hypnotherapist, who is going to tell us a few things about her field. Good afternoon.
Good afternoon.
I have some questions that I would like you to answer for me and for the folks watching us.
Okay.
First question, what is hypnosis?
Okay, what is hypnosis? And its simplest answer is an altered state. But the real answer is, I don't know. Nobody really knows what it is because everyone's experience of hypnosis is unique. So what we do in hypnosis is to use an altered state of mind to move the critical factor or the more conscious part of your mind off to the way, so we can work directly with the subconscious mind, which is really the part of your mind that's driving your
Is it some kind of mind control?
Absolutely not. Really, in hypnosis, it's not something I'm doing, it's something I'm facilitating. So all hypnosis is self-hypnosis. I'm just guiding you to where you need to go to find your answers. Well, hypnosis works a little bit differently for everyone. Everyone's experience is unique. But basically how it works is I offer suggestions and my client follows those suggestions. And I therefore can facilitate their experience and I can help them get to where they need to find the answers that they need.
Oh. How do you hypnotize someone?
Well, we have some very well-honed protocols that we use depending on what we're working with to give the person suggestions and that person follows the suggestions. So that's how I would hypnotize somebody, is first eliciting their agreement. So I'm not doing it, like if I were going to hypnotize you, I wouldn't do something to you. I couldn't make you say anything you wouldn't want to say. I can't make you do anything you wouldn't want to do. You remember the entire session. You're consciously aware. Even though your critical mind is off to the side, you're aware of what's happening. I offer the suggestions to my client. The client accepts those suggestions, and that's what begins the facilitation of the change.
What can hypnosis help with?
In training, we like to say that hypnotherapy can help anything that the mind affects, which is everything. But it's within limits. You know, there's certain things that may not be the best application for hypnotherapy. Some things the hypnotherapy can help ease, but maybe it isn't the best protocol. Maybe there's other ways in which a person could get relief that would work better. And the hypnotherapy might work really, really, really well in one particular instance with an individual, and then the next individual may not be as profound of a change with that person because we're all individual. And that's the beauty of hypnotherapy, is that, at least the way I've been trained to do hypnotherapy, is that I follow my client. Every client is unique. You have all the answers. It's my job to lead you to those answers and to facilitate your change, but not to create the change for you, because it's not about me, it's about you.
How can this help with people with mental health issues?
Well, we have a lot of people working with hypnotherapy for anxiety and depression. If someone comes in and says, well, you know, I'm sad. Okay, well, that's not diagnosed depression or anxiety. But if somebody has a diagnosis of depression or anxiety and say they're on medication, first I would work with, in conjunction with their doctor or their mental health care professional, because I need a referral. If they've been diagnosed with a condition, then I need a referral, because I'm not a doctor, I'm not a psychiatrist, I don't diagnose or treat, but I can work with somebody that, say, is experiencing anxiety. So what I would do is I would work with them to find out the client's experience. You know, where are they experiencing this anxiety? You know, what's coming up for them? What's their response to that environment? That's where the subconscious mind comes in. The premise is that your subconscious mind drives your behavior. Your subconscious mind is by far the greater part of your functioning mind. Things happen to you when you're a child, so events occur. The child concludes certain things about themselves because of that event. Then they begin to believe certain things about themselves, which makes them feel emotions. So that's what we work. We kind of back engineer it. We find out what is the person experiencing emotionally, what are they concluding about themselves because of that belief that they've come up with, and then we kind of undo it and kind of shed light onto that. And a lot of times it's a habitual thinking process that, you know, it's a gear that keeps running over and over again, and we have to put a monkey wrench in that gear and then reorder it and reframe that.
Well, now, do you find it comfortable working with a family physician?
Absolutely. I've worked with physicians, I've worked with mental health professionals, even a psychiatrist, in conjunction with a client. So, for instance, someone who has a PTSD or post-traumatic stress disorder, they're working with a psychiatrist or a mental health professional. I would get a diagnosis from that person, and then we work together. So I would be having conversations with that other mental health professional. What was the experience? What came to light? What did we discover during the session, and then let them know, here's what we're doing to proceed. There's a lot of cognitive behavior therapy involved with the hypnotherapy, with working with people with post-traumatic stress.
Oh, this has been quite interesting. Now, have people come with a smoking problem?
Oh, yes.
Yes. Okay.
People to stop smoking, to lose weight. Those are two of the most common things. And it's kind of a misconception. People are more aware of hypnotherapy, helping people to quit smoking and helping people to lose weight. But it's really far more than that. That's not the only thing that we can do. I mean, there's other kind of behaviors too, nail biting, hair pulling. I've worked with quite a few clients actually that, they hurt themselves and they pull their hair out. And again, that is something that I need to get a referral for, and then we work with that. There's a lot of different types of protocols that we can use, starting from just doing clearing work and doing programming sessions where the client would listen to that recording every day, and that repetition begins to influence the subconscious mind. We do parts therapy, we do regression therapy, and I've even done past life and life between life therapy to help to clear issues.
Well, now that's an interesting subject you just brought up.
Mm-hmm.
And so you've had patients that have had past lives.
Well, I don't have patients because I'm not a doctor
Oh.
or a mental health professional, but I do have clients. And it's interesting because you don't have to necessarily believe that past lives, that they really exist. Even in the model of a past life experience being a metaphoric journey, it's still very, very helpful, because why is the subconscious mind showing you that story? I mean, we teach our kids with story. The ant and the grasshopper. You tell them about the ant and the grasshopper. It's a third-party way of teaching that child, and the child goes, "Oh, I would rather be like the grasshopper." So when you do a past life, it can be a metaphor. And why is your subconscious mind showing you that story? What's that message in there for you? And that can facilitate changes.
Oh my, this has been most interesting, and I thank you so much.
Well, thank you. I've enjoyed
Yes,
sharing
it's been a
with you today.
delight, and it's opened a whole new world for me. Thank you, dear
Wonderful.
Cheryl. And thank you, everyone. Hope you enjoyed this. The greatest gift that we can be given is to have good health. And we hope that our entire life we have that. Unfortunately, it doesn't work that way. But when you have a child, and watch this wonderful child that you love deeply grow up and develop mental illness, and watch her grow into adulthood, and find from the years 20 years old to right now 53 years old, she has had mental illness all of this time. She has had bipolar, schizophrenia, manic depressive. There's a lot of different things with mental illness. And for some reason, the population of this country does not recognize it, or they choose to ignore it. There are 11 million children and adults in the United States alone that are having bipolar disorders, schizophrenia, and there is no cure. To me, it's a cancer of the mind. And because there's no cure, you have to have and you must take your medication. Without that, there is nothing that you can do. Unfortunately, my child said there's nothing wrong with her, and now is at a time and a point in her life where I worry about what she's going to do. And for some reason, she doesn't seem to want to go to the doctor. She says, "I need help," which of course that would be normal. And so I have been going to meetings trying to get a handle on this. Our Congressman Vern Buchanan and Congressman Tim Murphy are trying to do away with the system we have now about the mental health issue and pass a new law that will definitely help this country and the people in it, where they will be able to go and get their help that is needed, whether they can pay for it or not. We must, and it is crucial in my life, as well as the people who are watching this will understand what I'm saying. We must get rid of the social stigma of mental illness, the cruelness that people go on Facebook and say. And this has hurt my life, it has hurt my child's, when people ridicule her. So all I'm doing is hoping that when you see this, you will support what I'm trying to say and make people aware of mental illness, as they might be of cancer, heart problems, kidney problems. There's always big things for that. We need your support. We may not have it all together, but together we have it all. If you would like to send a donation, Mental Health Community Centers, 240 South Tuttle, Sarasota, Florida, 34237, and attention Peter Howard, Executive Director. Thank you so much.